Hello, my name is Alexia and I'm the host of the Fear Free Childbirth podcast and I'm also the author of Fearless Birthing. And today I'm going to be speaking with Megan Barnard from the University of Nottingham about a research project that we're collaborating on. Megan, welcome.
Hi Alexa, how are you doing?
Really well, thank you, really well. So so before we go too much further, would you mind just introducing yourself and telling us a little bit more about your work at the University of Nottingham?
Absolutely. So as you've already said, my name's Dr. Megan Barnard. I am employed as a teaching associate at the University of Nottingham, but I also get chances to pursue my research interests. What I'm really interested in is looking at the relationship between anxiety and how that affects what happens to us in the real world. And this is in any sort of domains in life. So, for example, my PhD was in transportation and looking at anxious driving, but I'm also interested in different domains such as test anxiety, social media anxiety, and also particularly with Alexa's work into fearless birthing. So looking at anxiety in pregnancy is something that really fits into what I do and really something I'm interested in. So that's sort of why I was interested in sort of doing this project and collaborating with you in the first place, I would say.
Brilliant. So the project that we're collaborating on, let's just talk a little bit about that so that people know what we're talking about. So essentially, one thing that I've come across in the work that I do is that women do experience levels of fear and anxiety during their pregnancy. And the work that I'm doing is, and I've developed a technique for reducing fear and anxiety, and it's really the work that as a result of the work I've been doing, I've really noticed the impact in terms of how women are able to reduce their levels of anxiety and fear throughout their pregnancy and how therefore that can impact on their birth experience in a positive way. And so I was interested in how we could get some evidence behind this and demonstrate this in a really powerful way so that we could then take this work further and introduce it to even more women, so that more women can benefit from having anxiety-free, fear-free pregnancies and birth experience. So that was where I was coming to, and then that's how we came together, wasn't it?
It's exactly what it was. So we got into contact about a year and a half ago now to talk about what your interests were and how we could fit that in within the university projects itself. So after a few months of getting that through university procedures, we're now running this study as an online questionnaire-based study. So anyone who takes part in it gets access to the Fearless Birthing Programme over part of their second trimester, and we're just looking at seeing how you feel, particularly in terms of whether it's effective in reducing any levels of anxiety itself. And it's been really sort of interesting to look at that project and look at those findings so far. So it's been a great bit of work to be working on, I would say.
And so, and particularly for you now, your situation's changed somewhat since taking on the project. So do you want to tell us a little bit about how your situation's changed?
Yeah, so when I first started this project out, it was I was just doing it as a typical researcher, getting involved, collecting data. However, at the time of recording this, I am 15 weeks pregnant. So a lot of what we're talking about in the programme, a lot of what's involved with the fearless birthing methods, and a lot of what you talk about resonates with me a lot more. So it has much more of a personal investment now, I would say.
For somebody who's interested, what is the process? What's going on for the study? What do they have to do to take part?
Okay, so in terms of our people we're looking for ladies who are pregnant, about to start or have started the second trimester of their pregnancy. And we're looking for over 18 years old UK residents. As long as you meet those basic criteria, what you would then do is contact myself. So I via email, or there is a call for participants website that we have that can be sent out to people as well. So you would contact me via those ways and I would talk you through, give you another brief description of what the project involves. But if you then were to take part and you were happy to take part, you would then complete 4 surveys over a 3-month period. Those surveys are looking through generally how you're feeling right in that moment, how you've been feeling over the past month, looking through particularly how anxious and depressed you may have been as well, because looking at fearless birthing, we're particularly interested in how it impacts levels of anxiety, both generally and in pregnancy specifically, and also levels of depression as well, because with anxiety, often depression is associated with it as a mental health condition. So we're looking at specifically these sorts of questions and interested in sort of what other techniques you might be using already, or birthing preparation methods. So that's what you'll be doing over the 3 months. And at some point in that 3-month time period, we'll also give you access to the Fearless Birthing program itself. So that's an online course looking at how to clear the fears and anxieties in pregnancy, with some wonderful resources by Alexa in there as well. Also talking you through the head trust clearance method, how to clear those fears efficiently. And it's all very much a self-paced course that you can go through at your sort of comfort levels, at your pace. And what we do over the next couple of months after that is just give you the same sort of questionnaires again, just to see how much, if at all, your anxiety levels and maybe your depression levels have changed as well. So we're hoping to see if with the Fearless Birthing program that it does reduce those levels of anxiety and depression in people as well.
So so all they have to do then is they just need to get in touch with you via the university or this website, the course participants website, which I will share the link for those people that are watching this or listening to this, wherever that may be. So we're looking for more ladies to take part who and do they have to be anxious to take part, or it can just be anybody? Are we looking specifically for people with anxiety and depression, or are we looking at maybe that anxiety that might come on during pregnancy, so people that maybe don't consider themselves to be anxious, are they welcome to take part?
Absolutely. Anyone who is, as I say, as long as you're starting that second trimester, it's anyone. You don't have to have anxiety specifically. You don't have to have been anxious before you're pregnant. As I say, the statistics did show that around 80% of women do experience that anxiety during pregnancy anyway. So, it's looking specifically at, how you are when you start the study, and then looking at the changes during those 3 months afterwards as a result of the Fearless Birthing program. So absolutely anyone who fits those very broad criteria can take part, regardless of whether they have a known anxiety or not.